Is a clinical examination enough to diagnose muscular dystrophy? Imagine trying to solve a complex puzzle with only a few pieces. A clinical examination is an important first step when doctors suspect muscular dystrophy, but it alone cannot give a complete picture. During a physical exam, a doctor will look for signs like muscle weakness, loss of muscle mass, and difficulty with movement. They will also review your medical history and family background, which can provide clues. However, muscular dystrophy symptoms often overlap with other neuromuscular conditions, making it tricky to be certain just from a physical exam. To confirm a diagnosis, doctors need to use additional tests. Blood tests are common and look for elevated levels of muscle enzymes like creatine kinase. High levels of this enzyme suggest muscle fiber damage, which is typical in muscular dystrophy. But elevated enzymes alone do not tell you which type of muscular dystrophy is present. Electromyography, or EMG, measures the electrical activity in muscles and nerves. It can help distinguish between muscle and nerve problems, but it cannot definitively diagnose muscular dystrophy either. A muscle biopsy is another key step. This involves taking a small sample of muscle tissue, usually from the thigh or arm, and examining it under a microscope. The biopsy can reveal characteristic muscle fiber abnormalities and deficiencies in specific proteins, such as dystrophin, which is missing or reduced in Duchenne muscular dystrophy. Muscle biopsy has a high accuracy rate, around 90%, and can confirm the diagnosis. Genetic testing is now considered the most precise way to diagnose muscular dystrophy. It detects mutations in the genes responsible for the disease, such as the dystrophin gene in Duchenne and Becker muscular dystrophy. Genetic tests can provide a definitive diagnosis, identify the specific type, and help with family planning. Imaging studies like magnetic resonance imaging can also be useful. MRI scans can show changes in muscle tissue, such as fat infiltration, which helps identify affected muscles and guide further testing. Functional tests, like the 6-minute walk test, assess how well a person can move and how the disease is progressing. While helpful for monitoring, they do not diagnose muscular dystrophy by themselves. In real-world practice, doctors combine all these pieces of information. A physical exam might suggest muscular dystrophy, but confirming the diagnosis requires blood tests, EMG, muscle biopsy, and genetic testing. This comprehensive approach ensures an accurate diagnosis and helps determine the best treatment options. So, to answer the question directly, a clinical examination alone is not enough to diagnose muscular dystrophy. It is an important first step, but confirming the diagnosis requires a combination of laboratory, electrophysiological, pathological, and genetic assessments. This thorough process aligns with current medical guidelines and is essential for early and accurate diagnosis, which can significantly improve management and quality of life for those affected. Always remember, if you or a loved one suspect muscular dystrophy, consulting a healthcare professional is the best way to get personalized and reliable information.